All right, so this mobility drill is going to be a way to start to get some work into the back of the hip here. And more specifically, like the capsule that surrounds the hip. And it's going to affect some of the muscle tissue also. But really, it's not so much of a muscle stretch as it is a capsular stretch. And so in this position, what we want to think is we want to try to use the body weight down through that femur, through the knee into the ground here. So to get into that position, we want to make sure that this is upright here. We can extend the opposite leg out behind you just as a balance point, depending on where where we're angling that hip. So once you're into this position, you can also start to drop the opposite hip. So my right side is dropping down as I lean to the left. So leaning to the left, but also dropping this right side down a little bit. I should start to feel some of the pressure here in the back of the hip, and that's a good sign there. We should be able to do some contract relax cycles here and it not change things too much. So we've got some weight down through the leg, through the hip. You wanted to spend time here, explore some different angles with the leg. You can turn out or turn in. If you push that leg out, you might notice some pinching. If that happens, start with the leg inward more. Spend a little bit of time there before rotating outward, and then see if you can gain some range of motion without pinching. We don't want to just push through that pinching sensation. But with this capsule stretch, you just want to hang out, spend time here. It's just starting to make some change. Make sure you're breathing through the whole process, and not holding your breath here. And then once you've spent a minute or two there, retest whether it's your squat, whether it's kind of a hip raise, or just kind of see if you're starting to make some change into that mobility. Make sure you're heading in the right direction.